Sandra, there you go. I was gonna say you can probably stop it until we get started, just so you don't have all the of us staring at each other waiting for to start.
No, I just
Okay. All right, so let's get into this. As the title slide says, I'm frozen. Am I frozen? My camera says I'm frozen. All right, there we go. The joys of working from my wife's office upstairs. Um, all right, so this is meant to be an introduction to the concept and the strategy of the Confianza ambassadors. And so, what I want to do today is do a little bit of introductions, just give everyone a chance to say who they are, start for us to get to know each other, tell you a little bit about Health Confianza as a Bexar County wide program, and then we're going to get into who ambassadors are, what the expectations are, kind of what the benefits for you as a potential ambassador might be, what the benefits for our community might be, and then a little bit about timelines and expectations. And then I want to open it up for a conversation with you. To make sure that we can tailor this program to both meet your potential needs and those needs of the communities that we seek to serve. Um, so because we like to get to know each other, I'd like to ask everyone if they're willing to share a little bit about themselves. We don't have to take long here because I don't want to prolong our meeting here. I anticipate that we'll be in this room for probably about 40-ish minutes, depending upon question and answer. So I want to make sure everyone can get back to family, friends, and loved ones for the evening. But if you wouldn't mind telling me who you are, maybe what neighborhood you come from and or represent here in San Antonio, Bexar County. How do you spend your days, right? I'm just kind of looking, are you a small business owner? Are you taking care of family, whatever it might be? We just want to hear a little bit about what you do on a daily basis. And then because Fiesta's right around the corner, whether you love it or hate it, I just want to hear a little bit about what maybe your favorite Fiesta activity might be if you have one. So I will get us started, and then maybe we can just do a popcorn where we'll just, the next person will just choose a name in the Hollywood squares, and we'll keep going around. If you're able to just show your face when you present, appreciate it, then you can turn your camera off right away. But so my name is Jason Rosenfeld. I live in the Beacon Hill neighborhood, which is just by Chris Madrid's, if you guys know Chris Madrid's hamburgers,
mhm.
or Blanco Cafe, whichever one is your preference. I spend my days working with an amazing team to promote health literacy and health decision making for our community here in Bexar County, as well as raising my two amazing boys. And then my favorite Fiesta activity is we're actually, I forget the name of it. It's one of the it'll come to me. But anyway, it's one of the coronation events. Yeah, that's a little bit about me. So I am going to choose Laquan, if you'll go next.
Sure. Hi, everybody.
Hi.
My name is Laquan Carpenter. I like to go by the name of Hummingbird, by the way. The neighborhood, I'm new to San Antonio.
Okay.
So I'm originally born from New York and I moved here from Arizona. I live on the southeast side of Arizona. I mean, not Arizona, of San Antonio. Sorry about that. Um, I am retired military and I have a small business that's here, Divine Destiny Products, a health and wellness business here. How do I spend my days? I spend my days happy. That's what I do. Anything that is positive or that I'm able to get into, uh, it doesn't matter. I spend them happy. I focus on um, the great days, the great times, right? Um, and my favorite fiesta activity at this moment, I really don't have one because I am not. I haven't really attended the fiesta, so I don't have a favorite fiesta activity right
Can you choose somebody from our Hollywood squares to go next?
now. Oh, okay, great. Margaret Mota.
Yes. So you said my name. So my name is Margaret Mota. I'm originally I kind of grew up in in this vicinity where the neighborhood place is at. Um, and right now I live closer to Helotes, but I come over here to the presentations that they have monthly uh, with the UT Health Science. And I spend my day, I'm retired. I'm a retired optician, 40 plus years in optical, and mother of three. And have a spread. I have one that's a nurse, one that's retired military, and one that is into musical theater and dance. Um, and I spend my days doing a lot of senior activities. There's a lot of senior activities, a lot of giveaways, a lot of dancing, a lot of workouts and things like that. So spend my days with that. And I'm a member of the Fiesta Commission. So anything and any event that's going on, there's a party, I'm there. So that's about what my life is about.
Thanks, Margaret. You want to choose somebody
And
for us?
excuse me,
You want to choose somebody else to go next?
I guess Edna.
Yes, hi, I'm Edna Cruz, and I'm also a retired RN. I'm a patient safety professional by certification, and I do a lot in the area of quality and also administrative support. I live in the Stone Oak area, and I act as a consultant to UT in the Long School of Medicine. I help do reviews for NIH submission, and I act as the community representative and look to see how we can translate research into community outcomes and public policy. And I just got appointed to the Nursing Advisory Council through UT also. And I try to make things happen there for the nursing department. So I can't say it any simpler than that. And then finally, I'm on the Bear County Translational Advisory Board. And so there I help to figure out things like research questions and things of that nature to help physicians position their research in the best light. And Fiesta activities, we like to go to Night in Old San Antonio. In fact, we just had dinner, and my husband was asking me, I have a busted tendon right now. So he was asking me, are you going to be able to walk for Night in Old San Antonio? And I can walk a little bit, but I can't walk any long distances because it hurts too much. But that's what I like doing. And let's see, who do I pick next? Sandra, Jason. Did Alice Alvarez go already? Would you like to do next, please?
Sure. Thank you, Edna. My name is Alice Alvarez, and I live in the Harlandale district on the south side of town in the same house I was raised in. So I'm very much planted here. I spend my days working with Sacred as a community engagement specialist and the housing content manager. So I do a lot of trainings and attend a lot of events and just try to spread the word about Sacred and connect great organizations to one another and to community. And Fiesta events, I always say, been there, done that. And that was great while I was bending there and done that. So now I don't do a whole lot of it. I'll just watch it on TV. If I see a nice Fiesta little market or something, I'll go walk around that because I love art. Um, but yeah, not much for crowds. I'm only 5 feet tall, so when I go to these events, all I tell people, all I do is smell armpits all day long, so it's not good. Uh, I'm gonna just kind of go down the list here. I don't remember who went. Ariel Gomez, have you gone yet?
May not be able to present. Looks like she's going
Okay,
through TSA.
okay. Dree Rodriguez. We'll just go down the line. Dree,
Hi guys.
there you
Uh,
are.
my name's my name's Dre, just like the rapper. So I always say I always joke around and say my name's Dre, just like the rapper, just minus the royalties. I live in the Alamo Heights area. I've been here for a while and absolutely love it. Spending my days, I work for SA Youth. I'm not sure if anybody's familiar with them. We've been around for the last 40 years. I'm their donor relationship specialist and absolutely love being there. So most of my days or how I spend most of my days is working. If I'm not working, then you can usually find me at one of the many different restaurants down in Southtown. I like to say that I'm a self-proclaimed foodie. So if anybody needs any recommendations, please hit me up. I either if I'm there or I'm doing hot yoga or at the Pearl. My favorite fiesta activity is Alamo Heights night because it's not crowded and you don't have to wait in line for the bathrooms there. And if you know somebody, then you might be able to actually get into one of the buildings and be able to use the bathrooms there as well on campus. And as alumni, they're pretty cheap. So another reason why it's one of my favorite fiesta activities. And if I'm not there, then coordination is one of my others. It's one of my go-to. Or NIOSA. I'm a self-proclaimed fiesta rat. So you will see me at Market Square for lunch any day of the week there during fiesta. So yeah, it's a little bit about me.
Thanks, Dre. I'll pick for you. Kendra, you want to go next?
Hi. Yes. Hi, my name is Kendra Lee Carpenter, and I am a grant coordinator and program support specialist at Westcare, Texas. I live in Pecan Valley. I work for the zip codes of the Promise Zone primarily, but the whole city of San Antonio. Um, I'm here because I'm going to be coordinating a team of public allies, AmeriCorps members, and maybe some community members that will be joining this cohort. But they're not able to be here today because they're in a mandatory retreat for their national service. Um, I like the Battle of the Flowers. That way I think would probably be my favorite thing because I like flowers. And I do like to just be a part of all the events that we help participate and host for Fiesta, whether it be for another organization or for like the women's home that we run on the South Side, the children and the mothers there. Um, and I think how do I spend my days? Basically working and thanking God that I have another day to spend. So that's about it for me. Thank you.
Thanks, Kendra. Donna?
Yes, hi, this is Donna Prado. I don't have my video
Okay.
available to be seen. So, I mean, I don't, it doesn't give me the option. So, just so you know, there it is. Okay. It muted me and took my video. There we go. I've got it now. Let's see. We're working on it. There it is. Well, I'm here. I don't know if you can see me. For some reason, the camera doesn't seem to be working, but I am here. Sorry, my name is Donna Prado. I work with Edward Castillo with the Southside Collaborative. I'm actually a freelance marketer, so I have a few different clients, but I kind of got here through him. So I just wanted to come in to see what the ambassador program is going to be like and just to learn more about it. I actually live out near Helotes in Gray Forest. So the Helotes Carnival will be coming up here shortly. So it's one of the Fiesta events that my actual favorite event is Corniation, which is so much fun to go to. Hard to get tickets though these days. So yeah, I'm a marketer, so that's what I do.
Great.
And I don't see anybody else's name that hasn't already gone. Melanie, maybe Melanie.
Yeah, here's what I'm going to do because I got a team here with me. I'm going to ask for the folks that are not part of Confianza to go just because I want to, in the interest of time, keep us moving. So, Candy, if you're able to tell us a little bit about yourself.
Okay, I can't find my camera, so I'm
No
gonna do the
worries.
same thing with Donna. And I know Donna. Hi, Donna. I'm Candy Diaz. I am part of the Southside Collaborative. I'm a co-chair. I also have a nonprofit in the South Side called A Hidden Heart. My focus is getting resources for seniors in the Villa Coronado and Mission Espada area. And I've been doing this for 6 years. I'm a professional filmmaker. And unless we're shooting something for Fiesta, you will not find me there.
Thanks, Candy. And I think Alicia Sanchez.
Hi. I can't find the camera. I put it in a show video, but don't know if you see me. Also like Candy, and I live on the far south side of San Antonio. I like chickens, have chickens. I spend my day with my chickens, with my plants. I don't go to fiesta unless somebody drags me to it, but it's not my favorite thing to do. And I help my mom. I'm a community health worker. And what else? I have also have lamb and I have bunnies, but not anymore.
Mm.
And I like to help in the community. Right now, I'm not working. Looking for a job, but I enjoy my day as it is with my parents. My dad's 86. I don't know if you heard of chicken, and my mom's 74. And I have 4 children, and I'm not a grandma. That's it.
Great. Well, thank you, Alicia. Is there anybody else who's not a member of Confianza or one of the core partners? I just want to make sure, because I want to keep us moving in the interest of time. So I think I got everybody. Well, thank you for humoring me. It's always good to just know who's in the room. So I'm gonna move us along here just to make sure that we get through these content. So, we're Health Confianza is a program that was born out of the COVID-19 emergency response. We are a health literacy focused program that's really focused on improving people's access to understanding of and utilization of health information and services. That's the definition of health literacy. And it matters because health literacy as a determinant of health is one of the biggest determinants of good and poor health, whereby people who are able to understand health information, where to find it, how to use it, typically have better health outcomes than those that have a harder time with that, right? And so it's about where do you find information? How do you understand information provided to you by a physician, by a healthcare provider, by a community health worker? And then also knowing where to access the services that are culturally and linguistically appropriate, right? And so Confianza was designed to try to reduce barriers to accessing and utilizing information and services, primarily around COVID. And now our focus is on preventive health. And so the way we tackle this, and I'm going to walk through the overall strategies here in just a second, is at multiple levels. So rather than just focusing on building an individual's health literacy, we're focused on building individual, but the workforce health literacy so they can better respond to and acknowledge people's lived experiences, but then also the organizations that serve our community. And we think through that multi-level strategy, we can actually achieve greater outcomes than just by working at one level alone. And so when we designed our program, we intentionally came up with our name, Health Confianza, because of the dual meaning of the word confianza, both trust and confidence. We wanted to help build and rebuild people's trust in healthcare systems, and public health systems, but also build people's confidence in their ability to make decisions. At the end of the day, our goal is to help people make informed, good decisions for themselves. Everyone's journey is different. Everyone's decision making will look different. And our job is not to wag fingers and say that one person's decision is better than another's, but to help them make the best decision for themselves with available information and services. And so, as I mentioned, the way that we do this is through organizational health literacy strategies, which my colleague Melanie Stone, who's the co-director of Health Confianza, also on this call, she leads that effort, helping organizations to reflect upon policies and practices and hiring and making sure that they're best responding to the needs of their community. We do workforce training, helping build the capacity of community health workers, nurses, social workers, anybody who is at the front lines of health delivery or information delivery around preventive health so that they provide health literate services. And then, like I mentioned, at the grassroots community level. And the ambassador strategy is one of our community level strategies that we want to tell you about today. And all of this is wrapped up in Sandra's amazing marketing and communication strategies with social media, mass media, all again with the goal of helping people know where they can go for information and services and to build their trust and confidence. So just a quick overview of our community strategies. You can see here our ambassadors, but we also do mobile clinics. We help host or table at community events to help provide information. We provide what we call Confianza conversations, which are community-based conversations with healthcare providers. We have a deep bench of university of physicians, nurses, and other healthcare providers that are eager to come into the community and to listen to what people's concerns are and questions and engage with them in meaningful dialogue. That's where that conversation comes in. And then we also have a deep dive of a peer-to-peer model called community health clubs. We do workforce training. This ambassador strategy is both community and workforce training focused, but helping build the capacity of community health workers, healthcare providers. We're going to provide a K through 12 nurses webinar series next academic year. And then we also do health professions training. And then finally, as I mentioned, the Pledge program, which Melanie leads, this is our cohort of 8 organizations that are taking a deep dive to self-reflect on their policies and practices, and then work together to identify paths forward for themselves and collectively to better respond to the needs of our community. And you can see the wide list of organizations that we are partnering with under this strategy. Where are we working? Our primary focus is on the southwest and east sides of San Antonio. Many of the communities that you guys have listed are where you're already working. Our original 22 zip codes are listed here on the left or right-hand side, whichever one you're looking at. The new zip codes that we're looking at under this new round of funding with Bexar County are on the right. So you can see really looking at that South San Antonio community. Reality is we're not picky. We will go wherever we're needed to address the needs of the communities that you are working with or the partners that you're working with. So that's the overview of Health Confianza. I'm going to keep going. So if you have questions, feel free to raise your hand, put them into the chat. But unless there's anything that's burning for folks, I'm going to jump into who the ambassadors are and what the purpose of this strategy is. So the goal of the ambassador program is really designed to tap into individuals like you. I mean, as you were all telling me about your lives and your work and your passions, you're exactly these trusted and respected community members that we want to be able to collaborate with to help people, again, make good decisions for themselves. We view ambassadors as local champions for preventive health and health literacy, and community educators and resources for both your community, but also providing a link back to our organization, our partners, West Care Foundation, West Care Texas, YWCA, South Central AHEC, and the Southside Collaborative as our core partners, but also to help collaborate with those pledge organizations that we mentioned and all the school districts that we collaborate with. Our goal is to, like you said, Alice, was sacred, is to help connect people to those services and resources in meaningful ways, and then help reduce the barriers to accessing information and services. And so as ambassadors, you become extensions of our overall collective, helping tell us what community wants and needs, helping to design content that is important, with the goal of building trust and increasing people's confidence. Like I said, you guys are cultural and linguistic insiders, so help us design information that is needed in the community, and then we can repackage it and send it back out in ways that the community can see their voice in the messaging. We want to help connect people to those services when they may not be able to connect, right? We learned during the pandemic that people would go to what we call like non-traditional health sources for information and services, schools, faith institutions, small businesses, right? And so if that's where people are still going, then let's empower those individuals to have meaningful conversations with community and then connect them to organizations and agencies that they know they trust because they're going to provide culturally and linguistically appropriate information and services. Whole goal is to bring information as close to people as possible, right? Get out of our academic white tower, get out of the public health white towers, and bring information as close to people. So what is an ambassador going to do? We would like our ambassadors to help us create innovative messages and content. I heard some focus on videography. I know many of you have different experiences and creative outlets. So help us design content that resonates with the communities that you serve. In addition to helping to design, we want to help then disseminate it, right? Some people are active on social media. We would like to be able to kind of tap into that expertise and knowledge. Some people have wide social networks, right? Let's tap into those networks to be able to disseminate trusted information through our networks, again, to help people make good decisions. So when we're designing content, it can be both led by you as an ambassador, or it may come from our Confianza collective, right? There's campaigns that we're working on that we're going to ask for your help to design and culturally adapt and then spread through our networks to make sure it gets as far and wide as possible. As I mentioned, we do mobile clinics and health fairs. We would like our ambassadors just to help promote those, right? Whether it's a social media promotion, whether it's word of mouth, whether it's putting flyers out into the community. But when we have those events, and we're going to have one mobile clinic event every single month where people can get basic health screenings, their A1Cs, their blood pressure. We're working to get vaccines out, right? So we'll have childhood vaccines, we'll have adult vaccines. There's always issues with insurance, and we're trying to work through those, but we want to be able to provide those every month in different locations around the county. But then we're also working with University Health to do mobile mammography. We're working with our dental school to try to bring dental clinics. So again, reducing barriers to access, and we're looking for folks to help us share that message. And then ultimately, the last thing that we kind of want the ambassadors to do is help connect us to other agencies that we may not be partnering with, but also connecting to some of those community advisory boards with the goal of just learning what is on the mind of our community. And so how can we best design our content and services to meet the needs of the communities that most need those services?
I have a question.
Yes.
So you mentioned that Health Confianza has been kind of like since the COVID period to now, right?
Mm-hmm.
So where have events or things that have been going on, where have they been held?
all over this all over the city. So we've been fortunate that we've built over partnerships with over 40 agencies. And we've had community conversations in schools. We've had community, like mostly SAISD, Harlandale, Southside. We've had community conversations with organizations like Fuerza Unida, with YWCA. We've had mobile clinic events on the near east side. We've had them on the near west side. We're about to have one on the far south side. So our goal is to be as responsive as we can to spread this information and services across the county.
Has it been, gone to the Southwest ISD area?
We don't have those relationships yet, but that's again where we're looking to tap into networks that you may have or others may have to be able to build that. So,
okay.
Yeah. Thank you for that question. And just to say again, like in our first iteration of this, we were able to reach over 10,000 people over a 2-year period with information and services, both through social media, but also through all of these different strategies that I described today. And we think by partnering with ambassadors like you, we can make that reach even bigger, because all of that was done through agency partnerships and less through kind of natural organic relationships that you guys have built. So In addition to develop, so to help prepare ambassadors for these expectations that I've just outlined, we want to provide a 6 session training. And so we're going to front load this in the front to help build your confidence and capacity to do the work that we would like to collaborate with you on. So we're looking at 6 1-hour trainings. We would like to do the first and the last in person to kind of build the relationships with each other. But then in the last one, we want to be able to do some teach back and give you guys some real-time feedback about communication and presentation styles. But the content of those trainings are listed here. So we want to talk about what are the social determinants of health, and how do those and what can we do to address them. We want to talk about health literacy and effective health communication, personal risk health assessment. We're going to talk about misinformation and internet literacy, this idea of shared decision making and what are some of the resources available. And then, like I said, we'll come back together for a teach back and a graduation ceremony before we all kind of go off and do this work together. But once the training is finished, I want to be clear, then we're not going to just leave you out there by yourself, right? The goal is to then have at least a monthly check-in where it's not going to be mandatory, but we want people to come together. What's working, what's not working, what additional training may be required to help you be more effective in this work. We're going to provide mentorship through our collective members. So I listed out all of our core partners. We also have an entire, like I said, academic healthcare university behind us, so we can bring additional technical expertise to bear. Edna's got lots of expertise in nursing and health education, so we can tap into each other to help build our capacity. Kendra, let me just land on this slide, and then I'll see what your comment or question is. One of our goals for those that are interested, and this is not required, is that by the time you kind of finish this commitment with us, we would like to be able to put your or the ambassador's names forward to become a certified community health worker within the state of Texas. Because the amount of work that I can see us doing over the course of this year would qualify you for that 1,000 hours of kind of grandfathered time. So hopefully that's an incentive that would be of interest. But we also have small stipend that we can make available to each of our ambassadors to kind of acknowledge time and effort, but then also help potentially pay for many projects, meetings, materials, or other expenses that might arise during this work. Kendra, yes.
So my question is about the community health worker certification, and I'm sure I could find this information elsewhere, but you're here. So, what is the total time commitment for that? And are you able to connect participants with their next steps and that certification?
So the requirements, so there's 2 ways to get certified. One is you take a course, and then once you're finished with the course and you've met the competencies, then you put forward by the training center. The second way is through experience, and through experience, it's 1,000 hours. And that is then signed off by a training center. Health Confianza is a state-approved training center for continuing education, but we also partner with Ariel, who's a state-approved training center for community health workers, and we would collectively advocate and help submit the application for those individuals to get that state certification.
So to be clear, this participation would give all the hours that were needed based upon your recommendation and then a final exam,
There's
or
no exam. It's a review of the application that gets submitted, and then the state determines whether or not those criteria have been met.
Okay, great. That sounds amazing. Thank you. That was my
Yep.
question.
So we hope that that is a kind of incentive for folks. Like I said, a little bit of financial support, putting time towards getting CHW certification, and then being part of this, what I think is a pretty amazing network of organizations that are dedicated to improving health literacy and health equity here in San Antonio. A couple last things, and then I'm gonna pause for questions because I know we're getting close to the time where my wife is gonna come kick me out of this room. Um, so we do hope that ambassadors will do a little bit of reporting. So there's 2 main responsibilities we're looking at, which is kind of content generation but then also health education and engagement, right? And so we have a really simple dashboard online that we've developed just to be able to have the ambassadors tell us what did they create, what was the purpose of what they created. Maybe it was a social media post, maybe it was a video of a message around measles prevention, maybe it was a flyer to help educate people about an upcoming healthcare event. We just want to know what you created and how you disseminated it. And then if you did any sort of education, one-on-one counseling, maybe you did a group conversation, maybe you got invited to a neighborhood association. We just want to know about it so we can document it and then tell the county about all the amazing work that we're doing together. And so if you decide to join us on this, we'll do an orientation on how do you use the dashboard, and it'll be a really easy app to where once you finish the activity, you pull it up on your phone, press submit, and you're done. So that's our expectation, is just on the reporting. And then the final thing is we want to have just a little friendly competition, right? And I'll kind of go into more of these, but like if you document that you've reached 100 people and developed 10 unique messages or content, then we'll have a celebration sometime in year 2. If you go above and beyond and you reach 250 people plus and 25 messages, we'll put your name in for a drawing of a raffle item. And then at the very end of the program, we're going to have a summit. And at that summit, we would like to have kind of everyone come together, and we'll just kind of have a messaging and content competition, friendly. Again, just we'll share it within, we'll kind of vote for each other and say, well, that was really innovative and cool. And those people will get recognized during the summit on like the work that they've done. So we hope that, again, will just be something fun that will encourage us to keep this work going. So next steps, we'd like to be able to do our first training the week of May 5th. Because time is running. And so I know that's a pretty quick turnaround, but I don't want to go too much longer. So that's the goal, only if it works for folks. And then we want to have those weekly trainings through the month of June. Knock it out, and then we're ready to go, and then we can begin our work together. Our implementation period would be June to June. And then, like I said, we're not expecting you to do a full-time job. That's not what this is. We expect people to engage as time permits. But to Kendra's point, the goal is to reach those 1,000 hours, right? Because if you want to get that certification, get those 1,000 hours, that's roughly 20 hours per week. Again, some weeks may be heavier than others, but we're not going to sit here and put some time stamps. I don't want people checking in on when their time is going to be, but we just want you to put forth whatever effort you're able to put forth. Kendra.
So the first training in person, the location and time is to be determined.
That's what I'm hoping. I can get some feedback from folks. Location, yes. If I've got a partner that wants to give me a location, I'll take it. Time is most likely, yeah, Kendra, thank you. Didn't want to say anything. But yes, if I assume an evening, kind of a 5:30 to 6 o'clock time would probably be best because everyone has lives during the day. So that's what I'm anticipating.
I agree with that. Most of the people that I would be having join would have a daytime work schedule. And we would be willing to support that here, just so you know.
Thank you. Margaret, did you have a
And
comment?
I understand that the first training would be in person. Everything else, everything in between first and last would be virtual like this.
Correct.
And
Alex,
I'm
give me
asking because I'm not computer savvy. I don't really, I'm more of a face-to-face, one-on-one person, as far as any kind of training or things like that, but that's why I'm asking.
Yeah, no, I appreciate it, Margaret. And part of it is just accommodating people's schedules and travel distances. Because, like, if you even just paid, like today, everyone is coming from all over the place, and so I want to
Right.
reduce that burden on folks. But if we need to work together with you, Margaret, to figure out how to help you with technology, or even if you wanted to come into the office while we were doing it, we could make this work. So.
Okay. Okay.
Alice, give me 1 second. I just see a question from Edna. What health issue needs have been identified in the South Side that are different from the rest of South San Antonio? I don't know if I would say they're any different. And honestly, we're doing a community microphone campaign right now to kind of highlight some of those differences. I think, the burden of chronic illnesses cuts across San Antonio. And really our goal for Health Confianza is about preventive health. And so our goal is to promote things like vaccinations, health screenings. How do you maintain health in your household, right? Why should you go to a primary care doctor? When you go, what kind of questions should you ask them to help you achieve your health? And so we're not going to hone in on like one specific health issue. But when we talk to people in San Antonio, what do we hear? Mental wellness. We hear chronic disease management, right? So it's diabetes, it's high blood pressure, heart disease prevention. Um, and then um, and then, of course, there's the access issues around that. So it's transportation, and it's actually health insurance. And then, yes, I've heard with Walk with the Doc, community conversations kind of similar. Alice, please go for it.
First of all, are we going to be able to get all of everybody here's contact information? Because I have questions for all the peoples. So can we connect with each other? Like,
I think as long as everyone is okay with that, then we can create that network. But because this was meant to be an information session, I wasn't going to offer everybody up their contact information yet.
okay, yeah, whatever, if anybody says that would be okay. My next question is, are y'all already connected with the HE Butt Foundation Know Your Neighbor conversations that are happening?
I'm not. Are you, Sandra?
I'm not, but we're aware of it. Yeah.
Yeah, because it's similar, and they would be able to like help your conversations. I don't know if there's a difference or whatever, but anyway.
I think the big difference is that we're focused on preventive health, whereas Know Your Neighbor, I don't know if they have a particular issue. It's more about like community advocacy. Yeah, yeah.
Yeah, kind of like knowing the history of whatever. Because the last one they did was the lines we live and die by, which sounds really depressing, but it's not. So it has a lot to do with redlining and how Southside doesn't have, as many, or now it has more, but as many doctors. Like when I was little, there was no doctor near here. You went far or you went to the curandera. A whole other conversation. And also, I know that our listening sessions we're planning to have, love to combine them with y'all's stuff because nobody needs more meetings.
No.
So if we can find a way to merge those together, but that's a conversation for another time. Okay, that's all
100%.
I got.
Thanks, Alice.
Thank you.
Um, to piggyback off of Alice really quickly, I actually am in the HEB Butt Foundation cohort for storytelling. So if anybody needs any connection with Elizabeth Coffee or Katie, you're more than welcome to use me as that resource. I actually meet. I have a meeting we have our cohort meeting on not this weekend, next weekend. So again, if you guys need that, you use me.
Yes, I would love to pitch Jason or Melanie as a guest. So yeah.
Yeah, I put my email in the chat, so you're more than welcome to just shoot me an email, and I will definitely get you guys in touch with our storytelling cohort because that's actually the cohort I sit on. So
Oh, that's awesome.
Thanks,
Thank you, Dre.
Candy, I see your hand up too.
No, what I wanted to say is that I've met Santos a while back, and we started a health club in the Villa Coronado area, and we do have we meet every Wednesday, and every other Wednesday we did a tea party, and now we're discussing mental health. So every other week we have a different topic. Tomorrow's topic is going to be about trauma, and it's about healing through faith. It's more of a support group for women, but everybody's welcome. All ages are welcome, and you know, we're trying to do something in the South Side.
Thank you, Candy. We want to continue to support you guys, so let us know what we can do to be there. Santos is amazing, so.
I didn't get a clear indication of the how to access the population that we're supposed to work with.
Yeah, Edna, it's a great question. So our priority population is everyone that lives in Bexar County. I know that's may not be a fully satisfying answer, but the reality is that when we're talking about preventive health, and the health disparities that exist here. We know what some of those demographic characteristics are, right? But the reality is I think everybody in our county can benefit from accessing and utilizing accurate health information. And so, yes, we want to target primarily people on the southwest and east side of San Antonio. Within that kind of catchment area, we want to talk to men, we want to talk to women, we want to talk to the aging population. We've got school-based programs. I know it feels diffuse, but the reality in my experience is like we have to have conversations with all of those people. And so what we would hope for our ambassadors is that you would kind of tap into your natural networks or the people that you're having conversations with. I don't want you to necessarily have to extend yourself to say, oh, I need to go find 25 men that are 30 to 45 years old, but who are you already talking to and how can we learn how best to serve their needs and generate content that is relevant for them?
So I'm just trying to think in my head if I'm going to develop something to teach about or to, talk about. How do I get to know my population? I mean, you're saying somebody I already talked to. I talked to a lot of people at UT, so.
So I love that question. I had a slide in here that I pulled out, but we have a pretty cool tool that we started using a few months back called a community microphone. And this is a really easy thing where we can set up on a QR code, a prompt, a question that you may want to ask. You can put that QR code on a flyer, you can put it on social media and just ask people what is on your mind about health? And then instead of them having to answer a survey, they hit the QR code and they just speak into their phone. It records their response. And then on the back end, that dashboard where I was talking about the reporting, we actually have an artificial intelligence tool that can immediately analyze the transcripts and give us those summaries. So if that's a tool that would be helpful for ambassadors to kind of do some of those needs assessments, right? Because who has time to go and talk to 500 people to find out what their
Right.
priorities are? You could still talk to 500 people without having to have the one-on-one conversation. So we want to make that microphone available to our ambassadors.
I see. That sounds like a really interesting concept because uh, it sounds like this population could be online. Is that correct?
It could be,
Social
right? I mean,
media.
again, like we're not going to dictate where you have these conversations or how you do it. We want to just make sure you're using those health literacy principles when you do it so that people can feel acknowledged and feel like they're not being talked down to, but given the information they need.
Okay, that's I like that concept. That kind of intrigues me. What I have seen other companies or entities do is they create a series of different logos, and for this it could be disease-oriented logos. And they put a logo up, and then they put a question and see what kind of conversation they can get started about, or what kind of questions people have. And
Right.
that's good for your microphone thing.
I'm
So
listening. I'm
I
just being
kind of
kicked
like
out of
that
my
idea.
office.
My office.
I'm still listening. So, any other questions or comments at this point?
When you when you speak agencies, what agencies are involved already?
So I mentioned our core partners. Actually, Sandra, do you want to field that while I just relocate myself?
Sure. We have 4 core partners, Southside Collaborative, YWCA San Antonio, they're amazing.
Okay.
Um, South Central AHAC, which is housed here at UT Health San Antonio, and West Care Foundation. They might have gone through a name change recently, I'm not sure, but West Care Foundation. So really, we wanted to have a organization in each kind of part of the like the San Antonio area donut, so west and south, southwest. That's kind of why we selected the partners, and their work, of course, is aligns with our work.
So and he mentioned that we work with others, like the organizations that are involved in the pledge program. There's 8 of those, and then there's many others that have taken our or participated in our programs, whether it be the pledge program or the community health trainings. So we have a large network already of
Thank you.
organizations.
Yeah. I'll just add San Antonio ISD is a core partner of ours. The Community First Health Plans within University Health is one of our partners. University Health is one of our partners. We've collaborated closely with YMCA, Mayor's Fitness Council. So we've tried to kind of build wide and far networks. And again, this is where if we don't have a partner, but you think we should, let us know who it is, right? Because our goal is capacity building, is building networks intentionally to reduce the barriers that our community faces.
How do you interact with the AHEC?
I can let Ariel answer if she's able to, but we do a lot of work together around community health worker workforce development. Go ahead, Ariel. I'll let you say it.
Yeah, no, thank you. So sorry about missing introductions earlier, but so they're a partner or we're their partner when it comes to doing, like Jason was just mentioning, CHW trainings, also this health literacy project. But we've been working together for a while now, and especially upskilling CHWs, which just has been a really great thing. So, did I miss anything else?
You're part of our pledge program.
Oh, yes,
Yeah.
and part of the pledge program. Yes.
Yeah, and we did a lot of work together, particularly under our first round of implementation on the workforce training, not just community health workers, but physicians, nurses, social workers, pharmacists. Edna, I think you're probably familiar with the ECHO model, the extension for community health outcomes. So we're also designing another ECHO series for workforce that'll be launched sometime in August. It'll be very similar to kind of what the ambassador training will be, but taking those health literacy principles and kind of plugging them into chronic disease and plugging them into vaccine promotion and just helping our workforce think about how do you integrate those principles into their practice.
And Dr. Adelita Cantu, who you may know at the School of Nursing, is one of our, she's part of our team, and she leads our mobile clinic efforts.
Yeah, I do know her. I'm very familiar with her. She's excellent. I like her a lot.
She's amazing.
Yeah.
So I want to respect our time. I appreciate all these amazing questions. We've got about 2 minutes left on what we had kind of scheduled. So it doesn't sound like anybody's resisting this. Again, maybe you are, but what I'd like to do is that if this is still of something of interest, if you wouldn't mind sending me and Sandra an email, and I'm putting mine into the chat, and I think Sandra will do the same, because we want to just try to get that first training scheduled. And then, whichever organization may have invited you here today, also just let them know so that as we're coordinating this first training piece, we make sure that the right people have been invited to it. If you have other questions, feel free to reach out to me. Feel free to reach out to Sandra. But I'll tell you, this is a program that we tried in our first round. We didn't do it as intentional with natural community leaders like yourself. It was a little bit more organizationally focused. But the reason I share it is that we presented some of our collaboration at a national level, and there are many around the country that were intrigued by this idea of ambassadors and how do we tap into you as natural leaders, small business owners, folks that are doing this work or having these conversations, but maybe are not necessarily, it's not your primary job. And so how do we help build your capacity and help address the needs in our community? And so I share this to say as like this, we're innovating around the edges here. And I think we've got a model that we can show at a national level that others will be interested in. And we hope that you'll join us on this journey. So
quick question. And this is from what I'm thinking, I understand it's more of group thing, or is it's not anything having to do like more of a, I don't want to do anything door to door.
If that, no, it's ultimately how you would like to kind of bring your energy and talents to this, right? So there
Okay.
may be folks that want to go door to door because that's their comfort zone. If you're going to have conversations, and again, I'm going to just give an example. Maybe you go to church every Sunday and you want to do something at your church. That's great. I know that Laquan was saying she has a small business. Like she could use the platform of her small business to just have conversations generally with people around these topics, find out what people are interested in, and then spread it around there, right? Maybe
Okay.
there's an opportunity to host something at your house. Again, I kind of
Okay.
leave it up to you to decide how you want to bring your talents and interests to bear. We want to provide content and technical expertise to help you on that journey.
Okay. Thank
And
you.
doing things online is okay?
Of course.
Just online?
Yeah, if
Okay.
that's your comfort zone, then that's where we want to help kind of help you curate that. So,
I just think the reach and access to people is so much greater
yeah.
that way than, going or trying to bring somebody to my house.
Of course, right? And so like trying to bring anybody anywhere is always challenging, right? I
Yes,
mean, even getting this first training, I guarantee you is going to be hard, but we'll make it happen. But also, where can you meet people where they're at, right? I'm going to actually start doing stuff at my neighborhood association because they've created the platform for it. So I was like, all right, I'm going to start bringing my own work into my private life because we can all benefit from it.
right. So, Jason, you said you're familiar with Walk with the Dog. They do that 5 to 7 minute talk.
Hmm.
Um, and it's a good way to mobilize people, get them walking and interacting with a healthcare professional at least once a month.
It's great.
And so if they can carry the practice of walking and studying something, or you could give them homework, I don't know. I think it's a good way to motivate people.
I love
You
it.
have any thoughts on that?
No, I agree with you. I mean, so we do something similar with our clubs. It was Candy that mentioned it, right? It's one of our strategies. It's not a walking effort, but we've had clubs that have come together to learn about health and nutrition, and they've become walking clubs because they're like, well, this is what we can now do, and so they mobilize themselves, and
Yes,
we've brought health professionals, residents, or others to kind of go out and meet people where they're at. So similar concept, just not around the like actual walking piece, because we let our communities kind of tell us what their priorities are and what they'd like to focus
right, right. Well, that's nice, because that's the exercise side of it.
on. Right.
But you also have the diet or the, food. Yeah, I mean, you could do a whole foodies club
Love
online
it.
if you wanted to, with recipes and good ways to eat.
I love it.
So
Everyone
if you
wants to get
have
together
diet
and
and
eat.
exercise online, my God.
Let's do it. I'll join that club.
I expect to see you there.
All right. Give me the invitation. I'll be there. All right, folks. Well, I appreciate it. I want to respect time. So if you need to run, please feel free to. We'll identify a day that week and we'll send it out and hope that we can get folks in. If you have more questions, feel free to stay on. I'll stay on for a few more minutes here before I have to go feed my hungry children.
Okay.
Yeah,
But thank you so much. Yeah,
I'll
sorry.
send a list of emails to everybody. If you don't want yours sent, just shoot me a quick note and let me know.
I just wanted to say thank y'all so much and have a blessed night.
Thank you, Kendra. You too. Drive safe.
Thank
Bye.
you.
Thank you guys
Bye-bye.
so
Thank you,
much.
everyone.
Nice
Appreciate
meeting
this.
everybody.
Good night, everyone.
Good night.
Thanks, Ludi.
Okay, bye.
Thought that went okay.
Yeah, yeah.
Stop recording.
Yes, I'll do that.